Thank you for attending our webinar today, Planning for Immediate Software Fixes. If you have any questions, please submit them to the BC Solutions email on the screen or on the website, and we'll provide answers and submit to all participants after the presentation. I would now like to introduce our presenter, Ms. Suzanne Butch. Ms. Butch was the Administrative Manager of the Blood Bank and Transfusion Services of the University of Michigan Hospital in Ann Arbor, Michigan. Since 2017, she has been consulting in laboratory management. She holds a bachelor's degree from the University of Michigan and a master's degree in management and supervision from Central Michigan University. She is certified as a medical laboratory scientist, specialist in blood bank technology, and a diplomate in laboratory management from ASCP, and is certified as a quality auditor by the American Society for Quality. She has been active in state, national, and international professional societies and edited books on irradiation and information technology in transfusion medicine. She currently serves chair of the ASCLS Leadership Academy and an advisor to ASCLS PACE Committee, and as a trustee of the ASCLS Education and Research Fund. She serves on the AABB Public Policy Strategy Commission and as a member of the AABB Coding and Reimbursement Committee and on the ISBT Working Party on Information Technology. Thank you, Ms. Suzanne Butch.
Well, thank you. Well, good morning or afternoon, everyone. This session today really is going to cover three important items, and that's how we prepare for an unexpected software implementation. So we need to define what is something that needs to be installed immediately. We need to discuss the procedures that we need to have in place and to describe the documentation, or in my next slide, the essential 3 Ps, the planning, the procedures, and the proof for our actions. Now, validation is necessary. We all know that. That comes from all our regulations, as well as it's referenced in the general principles of software validation. That reference, I'm sure you've used many times. So it must be validated to ensure accuracy and reliability and consistent with the intended performance and the ability to discern invalid or altered records. Now, what is validation? Well, let's look at it. Well, confirmation by examination and provision of evidence, that proof that I was talking about, that software specifications conform to the user needs and intended uses, and the particular requirements implemented through software can be consistently fulfilled. Well, software changes are inevitable, and we know that blood establishment computer systems are a special kind of software. They're more highly regulated. And then we also have the medical device data systems, or MDDS. That could be software electronics or hardware modems interfaces. They, in and of themselves, don't make decisions. Now, we know too that there's other laboratory, blood center, or hospital computer systems that the data from the blood establishment computer system feeds into. And then there's the software that connects and manages the data in very complex systems. So all of this is a big system. But keep in mind that the blood establishment computer system is the one of absolutely critical importance for validation. We have less validation for the other systems at times, depending on how the data flows into those systems. Now, what are our validation resources? Well, again, the general principles of software validation. We also have the Guidance for Industry, Part 11 of the Code of Federal Regulations, which is the electronic signatures and scope and application from August 2003. And then look for a new FDA document. I understand it's coming out. It's set for release sometime in fiscal year 2019. And since we just finished fiscal year 2019, it's not coming out then. But do look for it. It's going to be called Computer Software Assurance for Manufacturing Operations and Quality System Software. So what perhaps by the end of the year or early next year. Now, in the real world of things, we know that the validation may be urgent. We may have to do something that's not an ideal validation because we may need to make software changes because of software malfunctions and malware. Now, granted, I got this from the internet just yesterday. It told me that there were at least 140 governmental hospitals or local government facilities that, in fact, were ransomed and were affected by ransomware during the last year. So that's pretty frightening, and that's the one that bothers me the most and makes me think that it's really sometimes really important to get that software fix put in place. Now, urgency. Now, sometimes it may be urgent but not critical, so we can do our standard validation protocol. Or it could be more urgent when we can do some abbreviated testing before go live, or then an emergency, which is no validation before go live. And that means we really are putting out that fire that absolutely we have a threat of malware, or the system isn't functioning and we need to fix something. Now, we need a validation protocol for immediate implementation of software. So what does this protocol need to contain? What do you have to have in your SOPs? Well, first of all, who has the authority to install? And I should add here, who has the authority to approve the installation of new software? That needs to be defined, whether it's routine and in an emergency. I caution you not to tie your hands, though, with the emergency. There has to be someone available 24/7 to be able to make that decision. We don't want it to be the computer operator working the midnight shift. Then we need the documentation or the proof of what the situation is. We need first a description of the change. Now, I have been told that we don't often get the description of the change, especially if it's from our hospital information system coming from one of its users, or vendors, that the documentation may be limited. In any case, document what you did get. Any information from the vendor about the change and its impact should be documented. There ought to be a risk analysis. And if it really comes down to you can't do validation, why? Why weren't you able to do validation? So describe the absolute emergency situation that you have. Document any validation that's performed and the rationale and decision to go live. Now, what's a risk analysis going to look like? Well, here's a simple one. What are the logical things that will happen? It's unable to access the system, slowed down system, data losses, or compromised data. Those are the big things. Now, who do they affect? Well, first of all, it's a high risk for patients and donors to be unable to access the system. A slow system is moderate or low, depending on what you are. Data loss could be moderate, and compromised data low. Now, why do I make those different levels of risk? Well, in the situation of unable to access the system, we have a high degree of concern, and we have to go to downtime operations in this particular system. In a slow system, most of the time, we don't have to go to downtime operations, but it's possible. Our mitigation for data loss is the backup that we do just before we do this, if we possibly have time, and the same is true for compromised data. So we make a grid like this, and we evaluate, is the risk low, moderate, or high, and then list our mitigation strategies. You can probably think of more things to add to this grid. what you need to ask yourself some questions before you make the decision that this is absolutely urgent. And based on the risk analysis that you have, how urgent is it really? And you can say, yes, it's absolutely urgent that I do this without appropriate validation. Think about what problems have occurred with previous changes with this vendor. Sometimes there be nothing, and sometimes there have been serious problems that compromised operations after the fix was installed. And what post-implementation monitoring and validation should be done? After you've made this decision to go live, then you need to document, well, what am I going to do after I go live to make sure the system is operating appropriately? Now not the last, but we need to communicate to users what's happening. There has to be a system already in place that notifies the user that the system is going to go down or that XYZ is happening, and to look for potential problems. That's really why we want to notify the users, even if we don't expect them to see any change in their operation of the system. They're your eyes and ears to let you know there could be something going on. And then our post-implementation assessment, performing that is the last step. So all of those need to be in an SOP. Now again, the FDA, even if you did validate it, they're recommending that you closely monitor the system for a period of time after installation of the newer upgraded software to detect discrepancies that weren't identified in the test cases. Well, if we didn't have any test cases beforehand, we certainly want to monitor the system to make sure that it's operating appropriately. And based on how your software operates and problems that you've had in the past, whether it was a billing problem that was caused by a change, perhaps component preparation was a problem, whatever the problem was, you make sure that post-implementation of this software that we check on those. So our post-implementation assessment should at least cover a written report that includes the review of the changes that were made to the best of your ability to know what they were, a review of any deviations that occurred because of that installation, any review of the incidents, systems documentation. Did you have to change any documentation about the system because of this change? Did you have to change any procedures? Was end user communication effective? Is there any training that we need to give our users post-implementation? Is there something that they need to know? And document any lessons learned from this event. So in summary, urgent software fixes are a reality. You need to have procedures in place for this eventuality. You need to assess the urgency and make sure it's a real good assessment of that urgency, even if you're documenting it after you've done it. Perform a risk analysis, document your decisions, communicate to users, and that all-important post-live validation and assessment. With that, you'll be in the best situation for compliance that you can be with an absolute immediate need for a software change. Here's some references for you to use. And with that, we'll finish this mini webinar.
Thank you, Suzanne. And again, if there's any questions, please submit them to the BC Solutions website or to the email. And I'll be sending out a copy of this presentation to all the attendees. Thanks again, and have a great day.